Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll talk something about the repertory. The repertory part, which is a very important part in reaching the simillimum, because it gives you a group of remedies and then you can differentiate and then get to the simillimum. It is very, very important in a day-to-day practice how we select the rubric, because there are a lot of rubrics which are very close knitted, and they are called as linking rubrics. They are very close knitted, and then sometimes we fail to understand which rubric to take for what conditions. So today I'll just take a simple rubric called clumsy, a syphilitic rubric. Clumsy in Hindi it is called as bedanga, clumsiness. You have symptoms like awkwardness while walking, or awkwardness while eating, drops things while handling them, clumsy personalities. Okay, so this is a rubric which you have to take, and the meaning of this is lack of physical coordination or skill. There is no skill in that, or there is no grace in that. That's what is called as clumsy. Clumsy, if you find a personality, the first thing that should come to your mind is the rubric awkward. Awkward. There's a rubric called awkward, and it's a very important similar rubric to clumsy. But there are other rubrics, like you can find a child very clumsy, you can find an adult very clumsy. That is called as childish behavior. See, one rubric can give rise to so many cross references, so many close knitted rubrics. Next is that there is want of elegance. There is want of elegance. Elegant personalities. You like to see them. You like to hear them. You like to talk to them. Some personalities are absolutely not elegant. Those can also be called as clumsy, and that is how you have to differentiate different rubrics in your day-to-day practice. That is very important, because if you select a wrong rubric, then the remedies also changes. That's what is called homeopathy is an art and a science both. Next, chaotic. And what is chaotic? Absolutely chaotic means a person who does not that does everything in a chaotic manner, in an not in order. He cannot perform anything in orderly manner. Absolutely chaotic personality. And the rubrics depends on the rubric, and the remedy changes. So it is very important to have that rubric. On going further, you have foolish behaviors. That's also very close to clumsy. So this is how you have to differentiate different rubrics so that you can enter the remedy. I'll be very short in this type of videos, because I don't want to explain every rubric, explain every remedy. It will get more confusing, more elaborative. I'm just giving the rubrics which are very close to each other, that you have to consider in while taking a rubric for repertorization. Other rubric, that is gestures, makes awkward gestures. Awkward. Sometimes a patient comes to you and he behaves very awkwardly. He does some awkward gestures. That can be also grouped under clumsy. Sometimes you have very obstinate children's and very clumsy in their behavior. So obstinacy can also be taken into that clumsiness. One sentence written in a repertory: runs forward while trying to walk. Runs forward while trying to walk. A clumsy personality. So see, a single rubric called clumsy means a lack of grace, lack of that physical coordination. So we have lot of cross references, lot of linking rubrics which are very close, like awkward, childish behavior, want of elegance, or obstinacy. This is how you have to differentiate, like a chaotic, foolish behavior, cannot do anything in orderly manner. This is how one rubric leads to another. That's why in your case taking, you have to be very precise in which rubric you try to select. So clumsy, the most closest rubric that you should take is awkward. Go today, open the repertory, take the rubric awkward, and see the remedies, and see the differentiation in that remedies. A lot of people ask which repertory use and what repertory use. You use any repertory, but whatever you take the symptom for repertorization and put in the repertory will give that answer. So it is not important that which you take, it is important which rubric you select for repertorization. So this is a very short video. I hope it is an eye opener to you, and you are able to select proper rubric, because if the case taking is done properly, the rubric selection has to be done properly. So in this short video, go home and see the rubric clumsy, awkward in your repertory, so that you can be able to differentiate remedies in different rubrics. So my dear friends, if you like this video, do share and subscribe. Thank you.